Hello, this is Kayla, and I am going to share with you my leadership skills blog. After doing some reading and research this week, I feel that leadership skills, some may be born in us and others must be learned. But going through the different chapters in our book, I have learned some of these leadership skills I'm not exactly 100% strong on, and there are some that I need to work on. So, first question is, what skills are described in Chapter 7 and defined on the leadership skills questionnaires would you use to secure needed resources such as staff? And I feel like planning, that's one of the most basic leadership skills, and I feel I'm pretty good at planning. I'm always planning ahead, trying to make sure that everything's covered. I'm always thinking a few steps ahead to make sure that nothing, anything that may come up, I've already got everything pretty much planned out so that I can continue about my job. According to our book, Grohar, Murray, and Langdon, planning facilitates use of time and resources, and experience and knowledge facilitates the skills. So, again, I think this is something that we must work on as we go through life and work and get further along in our career. And I feel like planning is something I'm good with. Organizing, I'm an organizer anyway. Prior to becoming a nurse, I organize everything. I want everything to have its own place. There's two types of organizational skills, and that's vertical and horizontal. Vertical is, according to our textbook, is determine the number of levels needed to do the work. So how tall do the levels have to be? And then horizontal is the need to separate activities for more efficient and effective performance. So forming like departments. And I feel like as far as organizing, whether I use the in the vertical or horizontal type, I'm pretty good at working together and with my teammates and doing good at organizing. At our facility, we do use the horizontal leadership model of care, and it seems to work well. All of our groups and departments work together to get the job, the final job done, and we lean on different departments and levels of administration to ensure that we have everything we need in a day's work to get to the end result of safe patient care. What I do need help with and secured with is directing. You have to get work done through others, and there's 5 parts of this according to our text. It's giving directions, supervising, leading, motivating, and communicating. I'm good at communication. I'm just not really good at supervising others and giving directions. I have to work on my delegation skills, and I feel like delegation is a huge part of being a manager, and I'm not really great with that, and I feel like it's coming more and more with time. So that is something that I would need to strengthen in my leadership skills. I am a motivated person. I try to help motivate others, and that's part of directing and communicating. Like I said, I have good communication skills with others, and if I'm not sure about something or if I have a problem with something, I always go to that person and say something. Staffing. I've never really had to be in the position where I had to worry about staffing, but I work side by side with managers and leaders and charge nurses on a daily basis that have to be flexible and adaptable to change. And sometimes, staffing in the morning, it looks good the night before, and then people call out and they have to kind of adjust and move assignments around. So I feel like that's a hard job, and especially to make sure all of the level of work is balanced between each individual. So I would need some help with that as well. Coordinating. I'm good at coordinating. I like to ensure that the job is done. And coordinating, according to our text, is assembling and synchronizing people and activities to achieve goals. I'm a goal setter and I like to reach my goals, so therefore I feel like that's a good skill that a management should have. And then controlling. Never been a controlling type person, so even in my home relationships with family, my husband, my friends, I've never been a controlling type. So I would have a hard time regulating others. I'm more of a passive aggressive type, I guess, and that's not always the best, but I guess one time, and with positions, like if I was to move up to some type of charge nurse or leadership role, I would have to learn to be more controlling, not necessarily controlling every little move someone makes, but have a control on a situation or situations that could occur. Um, so, after those are the skills that I said, need to work on myself, or just a few things, especially directing and controlling. And then the other leadership skills I just need to strengthen as time goes on. The second question in this blog is how would you use the published literature in the process? And this is about transdisciplinary model of care. And I found this really good article on UNCW's website, and the title of it is International Emergency Nursing, or excuse me, that's the book it's from, and the title is Transdisciplinary Care in Emergency Department, a qualitative analysis, and there's several authors. One of them is Ines. But the first thing it's saying is in response to increasing demand, some emergency departments have introduced transdisciplinary care coordinated teams. And care coordinated teams are typically multidisciplinary and aim to decrease admissions, wait times, access block in the emergency department by preventing unnecessary admissions, readmissions, and providing safe and effective discharge. And transdisciplinary teams are a unique way of bringing together skills of different disciplines. So it's pretty much a transdisciplinary team is taking members of each department and a little bit of every little skill and bring it together as one team, and take that one team and work on patients, especially patients with a bunch of comorbidities that come with multiple complaints and needing several different systems. For instance, a patient with abdominal pain, we need radiology staff, we need CAT scan, x-ray, we need the lab, we need our physicians, we need our ED technicians to help us come in and draw the blood work, and we need the nurses to fulfill the orders that the physicians write. So it's just a multiple members of one team coming together and achieving the same goal of better patient outcomes and a safe plan of care for one patient. And we all have common goals, and that goal is to take care of that patient in the best that we can. So just a few things that from this article. It's just saying that their aim is all together to come together and just provide that patient with great care. There was a couple of one of the authors described the transdisciplinary team as a one-stop shop for allied health, and I feel like that's a good way of putting it. And it makes the patients, I've heard a lot of patients say, wow, you guys are fast, or you come in and you get the job done. And I feel like without transdisciplinary teams, it's hard to do that, because if one or two people are working towards that same goal, we have to work extra hard to make sure that everything is done. So it should be leadership's responsibility to help us come in and have some sort of care for that patient. And I feel like if they ensure that these teams are in place, that the care is more efficient. So a few things. They had this study, and the study was how did the transdisciplinary teams take place, and how well were they effective. And one part of this article says the transdisciplinary nature of the team made the team more effective, and participants indicated this decreased waiting and consulting times. So it cut down on time, teamwork was initiated, and communication, as long as there was effective communication, the ultimate goals were achieved. Because teams rely on effective communication. I feel like that's very important in order to continue care on certain patients. So the conclusions were these teams made for a quicker, better stay for these patients. So I feel like this is an important aspect of the model of care, transdisciplinary teams, and that management should ensure that those teams are working together and rolling out ideas and achieving goals. So that is the literature that I did look up. It was very informative, and I felt like it explained the use of these teams and the outcomes. The third question is identify the levels and departments that you would need to work with in order to be effective in your role. As a leadership, I feel like you have to work with all levels, higher levels up and lower levels. You need to work with your charge nurses and your staff nurses, along with your certified nursing assistants, and then supervisors, case management, and all radiology teams, possibly surgical teams. All teams, I feel like, work together in order to take the best care for the patient. So not only do we just work with those in our department, but outside the department, anyone that is involved in that patient care should be involved with the management. And management, in order to be effective in their role, should be able to communicate effectively with all departments. And if someone has a question in regards to someone's care, whether it be co-workers or patients or just any other disciplinary team involved in the patient's care, that manager should be able to easily go to them and just consult with them and answer any questions that they see fit. So pretty much anyone involved in the patient's care, I feel like the management should be able to go and communicate with. And then lastly, explain if you feel you would have a preference for a vertical or horizontal structure and a particular model, and why. I personally feel like it would be easier for me to work horizontally and not necessarily stack the teams up on top of one another, because just to kind of use the analogy, like if the Jenga, if you keep placing blocks up, eventually that tower's just going to fall over. But if you spread them across, then usually that weight is evened out across all of the blocks. So therefore, I feel like the horizontal structure is the best, because it's described by needing separate activities for more efficient and effective performance. Like I said prior to all of the other questions in our text. And I feel like the more departments you have and the more responsibilities are evened out across the whole disciplinary team, it's not all based on one or two people or going up the ladder. If we have multiple people trying to reach the same goal, as long as there's effective communication, there should be no problem with this type of structure. I feel like management has to be very strong though in this type of structure, because the more you kind of even it out, the more hands that are going to be involved in that type of patient care. So therefore, effective communication is important with the horizontal structure. I feel like managers have a lot of responsibility, and they have to be very flexible and adaptable to change. And I feel like the skills that are mentioned in all of these, the chapters and the readings that I have researched, are very important. Before I did all of my research, I did do the leadership skills questionnaire, and I was pretty much even between the administrative, interpersonal, conceptual scores. However, administration was my lowest. I feel like that's due to the lack of experience that I have already been able to go through. But I feel like with time that I will be able to grow in my administration part of my leadership skills. And I look forward to learning and being able to make a difference in my patients' lives. So I feel like leadership comes with time, and management comes with time as well. So it's just a matter of working it all out together. All right, thank you.